So, the Health Foundation of Western and Central New York has a really cool program. It's called the Fellowship Program, and it brings local healthcare leaders together of all different fields, private, nonprofits, for-profit sectors, and it's a way to build a strong collaboration to build a better health and care system in our community. So we did a survey last year at the end of the year in the community to say, what is preventing you from getting your children care? We were told it was access, it was transportation, it was getting that appointment. And then we said, what is the care you need? Primary health care, dental services, vision services, those were identified by the people that need the help. So what we're doing is we're bringing those services into the communities to make it easier for parents that are already so stressed and have so many other things pulling on their time.
And you say, have you done this before?
We have not. This is a pilot project.
Yeah, so we really are interested to see how many people will be attending.
That's right.
And you'll try to accommodate everybody who shows up.
We absolutely will. And really the goal is that if we can show a need in the community, our collaborators are willing to talk about doing this over and over and over again. And we really do think it's something that can be duplicated over and over.
The health pop-up idea, the whole service and coming into the community is the product of a team of health leadership fellows who are working on a team project over a 6-month period. And they're coming out into the community and engaging different providers, but engaging mostly the children and the families.
We have 1,000 families here in the Kenfield and Langfield homes, roughly about 3,000 children. Some of our youth needed glasses. They're getting glasses. Some had cavities. They're receiving dental help. And I'm so humbly grateful that this event is happening in this community.
The majority of the parents that take care of these kids can or will not take them to their physicals. We have kids who start school late because they haven't had their shots, they have not had any medical attention, and there are a lot of things that get neglected throughout the school year as these kids do not receive service. So it was a really wonderful thing for us to be able to serve our kids.
What's nice about this is it's kind of a one-stop shopping. The parents and the children can come in and they can get their hearing tested, and they can get their teeth looked at, and they can talk about issues with asthma or any kind of health concerns, immunizations, any of that, and they can actually get care here.
I'm really shocked to see so many children out here, and they're actually getting services, which is really unique.
A lot of the parents have little to no transportation, and so bringing the services directly to the parents and where they live at will help with, getting some answers and services that they need.
I really love the health pop-up idea. I think we've been working with an old model of care where people have to bring their health needs to the health providers, and I think that that's really complicated, especially for children and families in poverty.
I think the health pop-up is an innovative, wonderful idea that really focuses on bringing the services that so many children here in Buffalo need. Also focused on parents and getting parents involved, and also connecting families with services in the community after we're gone.
I love being able to get out into the community and just being able to educate people and just be able to screen people. So that's such a wonderful advantage anyway, but it's wonderful to get our name out.
We have 2 clinics, pediatric clinics. We have one over by the hospital, Children's Hospital, and we have one that services the east side. So we're trying to reach out to people in the community that don't know that we're there, so that they can have access to care.
They're connecting to folks in the community that might not necessarily come in their office, or if they come in their office, they may not have the same relationship. So this is about relationship building with the actual people that they're serving. So I think that that's the benefit for them.
As you can see, people are showing up and kids are getting served, and we're learning a lot about the community that we live in, and so it's been a great opportunity.
This team of fellows has been working very hard to come together and be a part of making services known to the community, in the community that's being served.
Again, an outstanding effort here, and by the volume of children that's here, you can tell it's extremely successful.
The premise that started this is probably just a kernel of what could happen. It's a wonderful idea, but in just looking at things here, there should be pop-ups for elderly, where we could do the same kind of hypothesis and reach the elderly. We could look at all different areas of the city. I think it's great.
After the pop-ups, Team Brahms met with host site representatives and community collaborators to plan for future expansion and long-term sustainability. It was a reinforcement of the emphasis of the project on 2 IOM core competencies of patient-centered care and interprofessional teams. The partners are on board for a long-term partnership.